And the Prime Minister joins us now in our Parliament House studios. Prime Minister, welcome to breakfast.
Good to be on the program.
Prime Minister, you say this is deep and historic reform. For the benefit of our listeners, can you explain why rearranging the funding formula from 40-60 Commonwealth state to 60-40, how that constitutes and provides deep reform?
Well, Fran, what we've done is two things. One is reform the system fundamentally, and two, provided investment growth for the future to provide more doctors, more nurses, and more hospital beds. Unless you have reform to deal with duplication, overlap and waste, then I think the Australian public would lose patience with any government who is simply going to throw money at the system. So you need to reform it to get rid of that waste, but secondly, you also need to grow it, because we don't have enough doctors at present and we don't have enough hospital beds. What we've done overall is bring in a national health and hospitals network funded nationally but run locally. For the first time in the country's history, the Australian government takes on the dominant funding role for the public hospital system of Australia. In the past, it's only funded about 35% or so of the running costs. Now, for the future, this will be 60%. And as a result of that, because our hospital system is growing so rapidly and our health demand so rapidly, for the first time we'll have the future needs of the system put on a secure funding base. The other part of the reform is this: run locally. That is, through local hospital networks. People across the country are sick and tired of decisions being taken by remote bureaucrats, be they in Canberra or state capitals, about their local hospital needs. So what we have developed is a balance between these two reform agendas, funding it nationally to put it onto a secure basis for the future and getting rid of waste, and secondly, providing more authority to local clinicians, local nurse practitioners and others to make sure that we've got the best decisions and flexible decisions taken locally right across regional Australia and in our larger outer metro areas, so that those services are best delivered to the needs of local areas.
Well, Prime Minister, a lot of the commentary this morning suggests or points out that you didn't get the level of control you were wanting for the federal government. We spoke earlier on breakfast to John Dwyer, Professor of Medicine at the UNSW. He likes the new money you've put on the table, but says it's not reform. If we can just have a listen.
No, it's not a health reform package. It's a complicated hospital finance package. I'm very glad that the extra money's come forward, or looks like coming forward. But I'm not happy that the system itself isn't being reformed, and it certainly isn't going to change the cost shifting. It's not going to stop the inefficiencies, the duplications. We're still going to have 9 departments of health for 22 million people. We don't have a single funder. As a reform package, we'll have to wait and see what lies down the road.
So, Prime Minister, John Dwyer thinks this won't stop the duplication, it won't stop the cost shifting. It is true, isn't it, that the money will now go through a lot of hands before it gets to the hospitals. It's not quite the federal control you were promising or wanting.
Remember, what we talked about was a national health and hospitals network which was funded nationally and run locally. We've delivered on that commitment in the reform plan which was put to the states and territories and which was agreed by 90% of the Federation yesterday, only one state holding out. The doctor who just made those comments, he's one of thousands of doctors across the country who frankly all have different views about the nature of the reform which should be undertaken. Mm-hmm. However, these are fundamental reforms. Let's be very clear about it. For the first time nationwide, we are introducing activity-based funding. What does that mean? Up until now, outside of Victoria, you've had a system whereby state health bureaucrats have simply provided an inflexible block budget grant to each local hospital area and told them that that's it, irrespective of how many services you deliver. What we find is that with the introduction of activity-based funding, the funding should flow flexibly to the services which are actually delivered on the ground through those hospitals and each hospital network. This is a deep driver of efficiency in the system, but a deep driver in rewarding those local hospital networks who deliver more services as well. This is a key reform. And secondly, when you talk about reform, for the first time we introduce, at political arm's length from everybody, an independent national hospitals pricing authority which determines the nationally efficient price for the delivery of individual hospital services. You've got to get that right as well, otherwise it gets politically manipulated on the way through. And finally, on the point that was just made about how that money is actually delivered to local hospital networks, for the first time The price will be set at political arm's length. It will be mindful of all the cost factors which apply across the country. For the first time, it will follow the actual services delivered, not just an inflexible block budget grant. And thirdly, what you also have is us delivering this finance through a joint statutory payment authority with the states for the first time, which actually delivers both our line of funding and the state's line of funding to the local hospital networks. This is a huge reform, and this is one we've been talking about with various medical reform bodies over the last 12 months as well, and represents an advance on where we were on the discussions as of yesterday.
An advance, no doubt about it. I guess what we're wondering is how, if it's gone as far as you wanted, because the premiers were claiming last night that, quoting John Brumby from Victoria, the states are the system managers. Are the states over-egging the level of control they're going to have over the funding?
Look, everyone will present yesterday's outcome in a slightly different way. I accept that, I respect that, it's a political debate. But at the end of the day, the key thing is this. When we said and launched the National Health and Hospitals Network Plan 6 weeks or so ago, we said very clearly that the individual service contracts between local hospital networks and state governments would remain intact. It would be based, however, for the first time on the cost of the hospital services being delivered, assessed by an independent National Hospital Pricing Authority. That's what's new here. What we've done is exactly consistent with that. That is the right way to go, and we think we've got the reform balance right here. The key thing, though, for everyone listening to your program, quite apart from the reforms being brought in, which drive long-term efficiencies and effectiveness in the hospital system of Australia, is stepping beyond that is the actual delivery of 1,300 new hospital beds, 6,000 additional doctors, additional 2,500 aged care places across the country, together with expanded mental health services to benefit some 20,000 young people out there through the provision of additional community-based mental health services. And on top of that, the Australian Government, for the first time, becoming the exclusive funder of the primary healthcare system of Australia, where the bulk of our health services are delivered each year, and the exclusive funder also of aged care. This is a deep reform, the biggest reform since the introduction of Medicare.